Fibromyalgia is a diagnosis that drives me absolutely crazy. And some of you might be irritated by what I'm about to say, but I need you to listen to the whole video. Fibromyalgia is not an acceptable diagnosis. And before you start typing your angry comments, I'm saying that fibromyalgia is not an acceptable diagnosis. I am not saying that fibromyalgia is not real. Your symptoms are real and it is not in your head, but the diagnosis is not acceptable. What happens is if you're someone who is experiencing a lot of pain, brain fog, unwellness, maybe depression, anxiety, you just can't seem to feel better. And you do the right thing. You go to your PCP, you go to the rheumatologist, you go to the neurologist, and you get all the testing done. And when they can't find anything at all, they call it fibromyalgia. And on average, it takes 2.3 years for a patient to get all the testing done just to be told, hey, we have no idea what's going on with you. We're going to call it fibromyalgia. And then in order to help your symptoms, you're going to be offered antidepressants or nerve pain medication. And I'm not telling you not to take it. I'm just saying there has to be something more than that. And of course there is. When your body is in that much distress, it's trying to tell you something. It's trying to tell you that there's something in its environment that is causing this mess, that's causing this inflammation. And you just have to find a way to figure it out, find the trigger that's making you so unwell. And there's so many possibilities: dysbiosis, SIBO, leaky gut, heavy metal exposure, mold exposure, thyroid, Lyme, adrenal fatigue. The point is that there are lots of things that need to be looked at as a potential trigger, because once you find the trigger, you'll be able to create a treatment plan. If it's a gut issue, we'll support the gut. If it's a thyroid issue, we'll figure that out. If you need to detox from mold, we'll detox from mold and heavy metals. If it's adrenal fatigue, we'll fix that. The point is that it's critical to find the root cause of why you're feeling fibromyalgia. In fact, this I don't feel good-itis is exactly why I wrote my book called It's Not in Your Head, because your body doesn't feel right and you don't know why. In the book, I break down the process used to get to the root cause of why you don't feel well. And then once you find that root cause, you're going to be able to treat it and actually move the needle on your health. I want to be clear that the conventional doctors that you're seeing, they're wonderful and they're well-meaning, but this is just not in their wheelhouse. Hope this helps. I'll talk to you soon.